All right, so talking about the regions of the human body is shown in an anatomical position. And remember, that's basically facing forward, arms to the side, palms facing out. And so this right here is showing you an anterior view. So the anterior view you can see right here is facing forward, right? Anterior just means the front part of it. So here you do see the forward part of the human body. And again, this is the anterior view. Here you see the posterior view, and the posterior view, you can see it's still in the anatomical position, although this is viewing the backside or the posterior side, right? Posterior is just the backside view, anterior is the front side view. So here are some more directional terms applied to the human body. So again, it's very important to be able to distinguish one part of the body from another. So that's why there's so much terminology involved here. And so directional terms describe the positions of structures relative to other structures or locations in the body, right? So basically just saying in relation to this organ or this part of the body, it's on this side of that body part. So here we see again cranial, right? And I mentioned earlier cranium is a skull, right? So when you see that cranial, you're talking about up here towards the head part of things. Right here, you see, so I'm just going to go down this arrow. You go from cranial to caudal. Caudal is just the lower part of the body, right? It's kind of the opposite of cranial. So here again, if you wanted to tell a part of the body, like if you had some kind of a growth or a mole or something here, you wouldn't say it was on the cranial part of the body, right? It was more on the caudal side of the body. Here we have what we just saw earlier, posterior and anterior. So anterior and ventral, they mean the same thing, right? And anterior or ventral, it just means along the front of the body. Right. And then again, posterior or dorsal means along the backside. And I always remember this because again, dolphins and sharks have those dorsal fins, and those dorsal fins are along the backside of their body. Right. So something else I probably should have pointed out first is superior and down here inferior. Superior, if someone is a superior, they're on top, right? They're high and mighty. So that's how kind of how you can remember superior means it's up here at the top, kind of high, and then inferior is down here at the lower part of the body. Right. So again, just different ways to describe where different body parts are. And then we have the right and the left, proximal. And proximal just means it's kind of closer to your body. And as you go distal, you're kind of moving out a little bit further. Right. So here you have the proximal part of the arm is closer here to the chest. But as you move out towards the hand, it is more distal. Same thing right here with the leg, right? The proximal part is right here, and then the distal part is right here. And so when blood is pumped through your body, right, it's more likely, it's easier for it to get to the proximal parts of your limbs, which are your arms and your legs, but it's harder for it to get out to the distal areas, which are your feet and your hands and your fingers. Right. So here you have medial, and that just means right here in the middle. And if you're to the side of the middle, then that's lateral, right? So lateral just means it's off to the side, and medial is more towards the center right here. All right, so cranial up top, caudal down low, posterior means like the back, posterior or dorsal means along the back, anterior or ventral means along the front, superior is up high, inferior is down low, medial is in the center, and then lateral is off to the sides. And then proximal is like really close to the core of your body, and then distal is further out, right? Proximal, distal. So just again, some of these. I'm not going to go over these in too much detail, but I do remember that superior, inferior, up and down, or sorry, the higher part of your body, the lower part. Um, and so, yeah, again, superior, inferior, up high, down low. Anterior is the front. Posterior is along the backside. Medial is in the middle, the center. And then lateral is off to the sides. Proximal is close to your body core. Distal is further out from your body core. Superficial, so these we didn't see before, but superficial means external. So if you have a superficial cut, it means you have like a cut outside of your body. If it's internal, it means that something got in there pretty deep and really got within the skin and did some damage, right? So these are all ways to identify different parts of the body. So this we saw briefly, but let's look at it again. So here you see the planes of the body. They're just hypothetical planes used to describe the locations of structures in human anatomy, right? So if you wanted to talk about a certain part of the body, maybe you are having some kind of issue here on this part of your shoulder. So you would use the different planes, right, to talk about where it is that it's located. And so you see the sagittal plane again, it's just an imaginary cut right down the center of the body. The frontal or the coronal plane right here, you can see this right here. It's as if you made a cut through the middle, like along the ears of the body right here, down the side of the arm, the shoulder, down the ribs, and down the side of the leg. That would be the coronal frontal plane. Right. And then the transverse plane is if you make this imaginary line right through above the hip, close to the hip area of the body, that would be the transverse plane. And so here we have a few different ones. So these are very clear cut planes. Some of these right here are a little bit off centered, right? Like the oblique plane, it's just any type that's not completely horizontal or vertical. Like it says right here, it just means it's not parallel or it's not at a right angle. So all of these that you see right here, all of these kind of lines through the body, these are oblique planes. They're not completely horizontal. They're not completely vertical. They're just doing their own thing, right? Like they're not either of those horizontal or vertical. And so those are oblique planes. Here again, the sagittal plane, the mid sagittal plane, it means right down the middle, right? That's what we saw right here. We were talking about the sagittal plane, but you also have something called the parasagittal plane. Whenever you see para, y'all, it kind of just means off to the side, right? It's not in the middle of something. Para means it's like on the outside or the side of it. So when you have a parasagittal plane, it's just a sagittal plane that's not it's not even, right? It's uneven. And so this red line right here off to the side a little bit, it is not this mid sagittal plane, it is parasagittal because it's kind of off to the side right here.